Living a life with epilepsy can be very overwhelming and devastating. Coping and managing epilepsy can be very difficult. Failing to adequately treat epilepsy can result in continuous suffering and negative impacts on the daily lives of sufferers. Epilepsy is a common neurological disorder impacting people of all ages. Epilepsy results in recurrent seizures characterized by abnormal electrical activity within the brain. Epilepsy impacts the daily lives of individuals as it leads to cognitive and learning difficulties. Moreover, individuals with epilepsy are more likely to suffer from anxiety and depression. Doctors usually begin treating epilepsy through the use of anti-epileptic drugs. In many cases, though, medications fail to control the seizure. This is visible in individuals suffering from partial onset seizures, which are uncontrolled by medication. Surgery is an additional option available which involves the removal of part of the brain that is responsible for seizures. However, there are many complications involved in this form of treatment. Besides medications and surgery, there are various therapies which provide an alternative to treating epilepsy. Many studies have depicted the great potential therapies have in successfully treating and reducing the effect of epilepsy. This is exemplified through deep brain stimulation therapy. You may be wondering, what is deep brain stimulation therapy? Well, deep brain stimulation therapy is a neurosurgical procedure which involves a neurostimulator which is implanted under the skin, sending electrical impulses through electrodes to specific targets within the brain. DBS therapy for epilepsy involves the use of a device referred to as the medtronic DBS system. The medtronic DBS system for epilepsy sends controlled electrical impulses to specific parts of the networks in the brain that are involved in the generation of seizures. The Medtronic's DBS system comprises of four main components. These are the implanted leads, which transport targeted electrical pulses to the anterior nucleus of the thalamus, the lead extensions, which allow for the connection of the leads to the neurostimulator, the neurostimulator, which is implanted under the skin in the upper chest and conveys controlled electrical stimulation at intervals, and finally the programming device, which can be further divided into two sections. The clinician programmer, which enables for the program to be customized according to the individual, and the intercept patient programmer, which provides patients with some control over their therapy. For example, if a patient senses that they're going to have a seizure, they can press the seizure button, activating the therapy. With any medical device, it is important that the efficacy of the device is thoroughly understood. This involves the use of clinical trials and research studies to understand the effectiveness of the device and through determining the benefits and risks it presents to patients. There are many benefits of using DBS system for epilepsy. The first is the fact that it is effective and well established. The use of Medtronic's DBS is clinically meaningful and well sustained. A randomized clinical trial known as SANTI was conducted by Medtronic, and a long-term follow-up of 7 years was implemented. The study allowed for the establishment of the long-term safety and success of the DBS therapy for epilepsy. The trial highlighted the significance of DBS as it resulted in a reduction in seizures and an improvement in the long-term quality of life of patients. The device is consistent and sustained. Also, the device allows for customized programming, which allows patients to receive therapy targeting their specific need. Finally, DBS therapy can be reversed as it does not involve the removal of brain tissue. The therapy can be turned off, and in a majority of cases, the system can be removed. There are always risks involved with medical devices, hence it is important that such risks are taken into consideration. Risks of DBS therapy for epilepsy include bleeding in the brain, stroke, and seizures as a result of the implantation of the DBS system. Infection is an additional risk, and it is one of the most commonly reported risks involved with DBS therapy. Once implanted, the system may become infected, which can then impact the health of the patient. Mechanical or electrical problems may also arise, resulting in the system to suddenly shut down. During a report on the Medtronic's DBS system, one patient had incorrectly positioned electrodes from the initial placement. However, this was quickly corrected with no complications such as neurological symptoms occurring. Other risks include impact on the mental state of the patient, as depression and suicidal thoughts have been reported in patients receiving Medtronic's DBS therapy. In summary, epilepsy is a complex disorder impacting the daily lives of many individuals. Medtronic's DBS system for epilepsy has portrayed beneficial results in individual patients. DBS therapy holds great potential as an alternative treatment method for epilepsy when medications and surgery fail. This is highlighted by the reduction in seizures experienced by patients and the increase in their quality of life. Although there are certain risks involved in DBS system, these risks are identifiable and addressed immediately in all patients.